Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
A study recently published by the American Cancer Society found that the number of people dying of cancer in the United States has dropped continuously over a 25-year period.
That's awesome.
Yeah, the latest data is up to the year 2016. The American Cancer Society believes that the decline in smoking and advances in treatment and early detection are key factors in the continuous drop.
Makes sense to me.
Yep, it's all good.
But cancer remains a big problem in the U.S. The report estimates that this year there will be 1.8 million new cancer cases and more than 600,000 cancer deaths. Here to help us break down those numbers and tell us where we are at in the war against cancer is Chair of Oncology at Mayo Clinic, Dr. Jan Buckner. Welcome to the program, Dr. Buckner. It's nice to meet you.
Thank you. It's good to be here.
Thanks, Dr. Buckner, for joining us. So we are, I guess, winning the war, but it's not been easy, has it?
Right. I think we are winning, but we're not quite ready to declare victory yet.
Wasn't it Nixon who said that our goal was to eradicate cancer by the end of last century?
I think it was. The National Cancer Act was in 1973 and was the time that Mayo Clinic established its Mayo Clinic Cancer Center.
Do you talk about some of the reasons why we are in decline when it comes to cancer, why we are winning the war?
Cancer deaths, yeah.
Cancer deaths, yes.
Well, I totally agree with the American Cancer Society. One of the main reasons is that through public awareness, there has been gradual increase in smoking-related cancers since shortly after World War II, when it became there were folks that were starting to understand that tobacco really is a carcinogen. And lots of public campaigns that have made the public aware of the dangers of smoking. And that's the main cause.
The other thing that has helped is better treatments. And it seems like there are certain cancers that we're a lot better at treating, but certain cancers still defy all of our best efforts.
Yes, there has been in many, many cancers increasing 5-year survivors through better treatment, notably breast cancer, colon cancer, and more recently lung cancer. With the advent of immunotherapy and with personalized medicine so that we can identify the genetic alterations in the tumor and treat specifically, we are seeing longer survival, even in people with advanced stage cancer. Mayo Clinic is very involved with testing new therapies, both immunotherapy and personalized therapy through clinical trials, and almost every week or every other week, there is a new treatment breakthrough for people with cancer.
You know, in the 40s, 50s, 60s, 70s, there was, people didn't even want to say the C word. It was such taboo even. When it comes to today, and screening is so much, everyone goes in, I would think. It seems like a lot more people go in for screening than ever before. That has to be making a big difference as well.
Well, it does. Now there are screening recommendations for breast cancer, cervix cancer, lung cancer, colon cancer. In fact, on the colon cancer side, Mayo Clinic has really led the way in developing non-invasive screening tests by the use of a test called Cologuard. Which just requires a stool sample. It doesn't require a prep. It doesn't require colonoscopy. And we are seeing people being screened for the first time because it does not necessarily require colonoscopy.
So back in the 60s and 70s, was there any screening at all? I'd look at both of you to answer that question
With
for me.
sigmoidoscopy, we had. In fact, we did them on each other in medical school. But it's a long silver tube that only examined the lower part of the colon. And that's what was being used back in the 70s and 80s, as I recall. But
well, there were a couple of others. Pap smears have been around for a long time for cervix cancer. And also testing stool for blood has been around for a long time as a screening method. Mammography has been around for a long time for screening for breast cancer. But not everyone has their cancer detected on some of those screening techniques. So one of the areas that we're interested in here at Mayo Clinic is molecular breast imaging, and looking at the stiffness of the breast tissue. Because cancers tend to be very stiff, it's possible with a technique called elastography to actually determine if there is an area within the breast that is more stiff and more likely to be breast cancer.
Tell us a little bit more about immunotherapy. We all sort of know what chemotherapy is. It's poison. It poisons not only the tumor, but unfortunately it has some adverse side effects. Immunotherapy. Explain to our audience what that is.
Immunotherapy is pretty straightforward. The goal is to teach the body's own immune system to recognize a cancer that previously it did not recognize.
So your body let this cancer grow, and it shouldn't have, but the immunotherapy will help your body recognize the fact that this has got to go.
Exactly. In some ways, it essentially takes the brakes off the immune system so it can be much more aggressive at seeking out and eliminating cancers.
Unfortunately, cancer is linked to obesity. That is on the rise.
Obesity is on the rise, and there are several obesity-related cancers. The common ones, breast cancer, colon cancer, prostate cancer, and others are all associated with obesity.
Ovary? Isn't cancer of the ovary more likely in obese women, or no?
You may be right.
Oh, yeah, okay. But it's unfortunate because there truly are cancers that are more likely to occur in people who are obese, and there is an epidemic of obesity in this country. So we're making progress on the one hand, but obesity is kind of holding us back.
It is. There are some efforts going forward to find out why is obesity associated with cancer and what could we do specifically for obese patients to reduce their risk. For example, we're involved in a clinical trial in which overweight women have counselors by telephone to help them reduce their weight and increase their activity. And we will see if that can help to reduce the recurrence rate of breast cancer.
And what are the socioeconomic factors that affect cancer rates?
Unfortunately, folks with low income have a higher rate of cancer and are diagnosed when the cancer is more advanced. So we really do need to address this disparity. Part of it is likely related to access to screening and prevention and related to reduced access to treatment. And there are also other factors such as smoking rates that tend to be higher, and obesity tends to be a bit higher in low income patients and families.
So we're obviously doing better. Is there any reason to think that there will be a major advance in the treatment of cancer in the near future?
As I mentioned earlier, almost every week or every other week, we are getting a notification from the FDA that a new drug has been approved for the treatment of one cancer or another. So we have every reason to be optimistic.
All right, to you and your colleagues, keep up the great work.
Thank you.
We've been talking about recent news on the declining number of cancer deaths in the United States with the chair of Mayo Clinic's Oncology Department, Dr. Jan Buckner.